Hello, good evening, and thank you for keeping it TV 47. This is Body Garage with I, Sheila Chelangat. Now, next Monday, on the 3rd of March, the world would be commemorating the World Hearing Day, a day that is set aside to promote and raise awareness of ear and hearing care. And so tonight, from the Nairobi ENT Clinic at the Anderson Center, 5th floor at the Nairobi Hospital, we have Dr. Grace Mwangi, who would be taking us through ear and hearing care. How are you, Daktari?
Hello.
How are you doing today?
I am doing fantastic.
Okay, please introduce yourself to us and my audience.
Okay. I am Dr. Grace Mwangi. I'm an ENT specialist, ear, nose and throat, based at Nairobi Hospital, more so Nairobi ENT Clinic, which is a purely specialist clinic. And we deal with a majority of the ear and the nose and the throat.
And the throat.
Yes.
So tonight's episode, we are focusing on the ear. So what makes up the ear? Is it just this piece that we see outside? What does the anatomy of the ear look like, and what are their functions?
Okay. I would want to tell you that I have a keen interest, in as much as I'm an ENT specialist, with a bit of passion when it comes to the ear. What we like to have fancy names and say called otology. And so when we talk about the ear, we're talking about one of the organs that we have the 5 senses in our body, which is purely for hearing for most people, but you need to understand that it also has a part for balance. Okay. And if you remember biology, we used to be told the ear has 3 parts, the outer, the middle, and the inner ear. And basically the outer ear is what we see structurally outside here. And beyond that, there's a canal, which I usually like to describe as an cave, where we like probing. And beyond that cave, there's actually what is known as an eardrum. So that's what constitutes the outer ear. The middle ear is just beyond the eardrum, which is a space, and it has bones. Who knew your ear has bones?
Okay.
Yeah, ENTs, we can also deal with bones. So there is actually the middle part of the ear that has bones that I like to describe like when you go for a football match, and there is the wave that we do. The 3 bones of the ear create a wave. Okay. And those 3 bones are able to send a transmission to what we call the inner ear, which is the 3rd part of the ear, which is, can I say, the most crucial part of the ear, because this is where we have parts of the ear that you cannot replace. So that's what is basically an ear: an outer, the middle, and the inner ear.
And the inner ear. Okay, you've said it's not just about the hearing, it also does balancing.
Yes.
What do you mean by that?
When I say that, the inner ear looks like a snail. You see the big house that looks like a coil? So that inner ear has a part that is responsible for interpreting the sound, but moreover and above that, it has a part that is able to give you balance and orientation. And sometimes some of the diseases that I can say that are missed out, and you have dizziness, or people can describe it as lightheadedness, or I was about to faint. If you come across a few doctors, they throw something in the whole terminology, what we call vertigo. That is also a part of the ear that is actually responsible to get you orientation when you are having a balance issue. So the ear is not purely about hearing, it also has a part for balance.
For balancing.
Yes.
All right, Daktari, let's move on now to some of the common conditions related to the ear. What are they?
When you rush to the doctor, it's never to say hi, right? I believe when you go to the doctor, you also want to avoid as much as possible, right? So that's why you always take your apples every day to avoid sickness.
To avoid you.
And when it comes to the ear, now most people will know that it's for hearing. So if you have a reduced level of hearing, that mandates you to come and see an ENT. If you do have pain, whether you like it or not, most people will rush in. If there's an ear discharge, I mean, our ears don't come out with pus or bleeding. Those are reasons to come in. And as I've told you, and I've even informed you, if you have dizziness, please, that's also something that would warrant you to give an option of seeing an ENT. Yes.
Okay. And what would be the risk factors that would probably make me get some of these, symptoms that you've mentioned?
The most unfortunate thing about hearing and also about the ear is if you have a problem of hearing, it's invisible. What we say, an invisible disability. If you are blind, people can grossly see you fumbling around.
Yes.
But if you're not hearing, no one is able to appreciate that. You might feel withdrawn, you might feel in your own box. So basically, when you have a hearing loss and there is that, then that brings you in. What would bring this? We are young. I would like to think I'm still young. But just with the body and how it is known to be, as we age, even there are other things that age, including your ear. So we do appreciate that an aging ear might not work as optimally as it did when you're in your 20s versus when you're in your 80s. So age is something that you can't change. However, things that can hasten things that bring about this. COVID came in. Do you know how cool it is to wear ear headsets?
Yes.
The only unfortunate thing, what do? We concentrate loud noises. Noise is sound at exaggerated levels.
Yes.
Right? Even when you are alone, you are insisting on that headset and at high volume. Two, we want entertainment.
Yes.
Entertainment means Friday, Saturday,
and
Sunday.
And even Monday.
Wow. Probably we need to check on your hearing. Fun. And basically what it means is when you go for concerts, these are exaggerated levels of sound. And these are things that we are always on the lookout for. And then there's little small little things. If you are putting cotton buds in your ears, quote unquote cleaning the ears, you'll be surprised how the ENTs will have a little bit of a problem with
Okay, we will get there, Dr. But then you mentioned something about age and hearing. So is it true that my hearing will get worse with aging?
It is not surprising that your hearing will depreciate with age, but it doesn't mean that it has to reach a point where that it affects your quality of life.
Okay.
If there are things that you can do right now to hasten the aging process, why not? And that's why people will not walk around everyone with a hearing aid, which is an assisting device. However, we do respect that as you age and you age gracefully, which includes also our ears aging gracefully, if you have a deficit that is enough to interfere with your quality of life, please get that hearing aid. The same way, if I'm holding my book, and you know how our parents start,
you just start going.
The book just goes further and further.
Yes.
Then all of a sudden, everyone has the glasses and they look at you with that condescending look. A hearing aid works.
You've mentioned something that I'm very guilty of, the headsets and earphones. So then what is the recommended volume that I should use when I decide to use my headset?
Okay, so sound has a measurement. The same way you'd say water in liters, in tons. So sound is measured in what we call decibels, basically loudness. And when you talk about that, there is what is known as levels that are not damaging to your ears. And when we say damaging, you remember when you talked about the inner ear?
Yes.
There is what I can say sensors, and they are very fragile hair cells that will keep on bending in and out because of high sounds.
Yes.
Now, if you put too high a sound, it means it can and get damaged. Unfortunately, the hair cells are those organs or parts of your body that you cannot replace. How sad that is.
Yeah.
You cannot go and replace an inner ear. And so we really want to protect. So normally we would say 0 to 20 decibels is what we call normal hearing. If we talked about our day-to-day activities, by the time you're using a vacuum machine, you're almost about to get to 70 decibels. Do you know how annoying a vacuum machine is?
I know, it's very annoying.
So by the time it's hitting 30 minutes of it, you're like... So we don't walk around getting into the matatu and checking how many decibels is this mat.
Yes.
All right? But if you are working, let's say, in an airport, and that's why you always see them with these protective devices, the kind of noise that is in the airport in terms of decibels is so high that it can be damaging that you have to protect your ears. So some of these little small things might be damaging, but it's a matter of repetitiveness. Two, it can also be as a result of one insult. When we watch movies or when a bomb blast happen, one thing they show in the movies is when there's a blast, they create this noise.
The ringing sound, yes.
Yes, what we call tinnitus. And it's basically, it's an insult enough to affect the frequencies. So you can have damage from one big blast or continuous insults.
Okay.
Continuous insults are what? If I'm always in the club, Monday, Tuesday, Wednesday, that have your fun. But please be sure that chances you might want to see an ENT earlier than you'd want to see. Right?
Okay. Now, there's this common terminology when everyone has an ear problem, I have an ear infection. I don't know what does ear infection mean first, and what even causes it?
Okay. So ear infections, these are things that can act just the same way you can have a flu, just the same way you can have diarrhea, just the same way you can have quote-unquote pneumonia. You can also get an infection of the organ itself. And just the same way, outer, middle, and inner ear. Fortunately, our ear is also developing. So that's why a child is more prone to ear infection versus you as an adult. And because kids love each other more, I think, than adults, don't you think so? So they share a lot, all right? Their immunity is not at its maximum. So it's going through its own hurdles. And if you look at when they go to school, every parent will be like, oh, here comes the flus. Now, the ENT is a common conduit. There is little channels that connect these places. So a child whose immunity is not 100% still, just because of nature and you're going through the virtues of development. Two, the ear has not fully formed. When we say that, you know, when you yawn and you feel a pop sound, or when you blow your nose and you feel fullness, there's connections between your nose and the ear. That tube is still undergoing a lot of maturation, and that can be a conduit at which you can get ear infections. So what does an ear infection mean? You can have a painful ear. You went to coast, you swam, and you enjoyed, but guess what? Water is not sterile. So in the right kind of environment, if that water gets trapped together with wax, you can get an infection in the external ear. Unfortunately, as children, as I said, due to time as a factor, maturity of immune systems, you can get a lot of middle ear infections. Unfortunately, that can give you even damage to your eardrum. And some people come in as adults and we tell them, oh my God, you have a perforation in your, which is a hole in your eardrum. And it's just because of something that stemmed in your childhood. Okay. All right. And of course, if you have discharges, if pus is coming out, don't you think that's a problem? Oh, that's a problem. Yes, if there's pain, if there is definitely fevers and all these other things.
Okay, and you've mentioned the perforation, so to the eardrum. Now, how do you treat that?
So when we talk about ear infections, and more so when we talk about the cohort, the group of people who get this, you can get an ear infection at any time of your life. But as I told you, majority of the people who get it are the small kids, and more so in the middle part of the ear. Remember the eardrum behind there? If that infection is enough to create a hole, and when I say hole, it's because you feel pain. Sometimes there's pus that accumulates over there, and pus, as we know, always tries to get a way out. The eardrum is the easiest way out. You can easily get over it by sealing the eardrum. Once the infection clears, you're given drops, you're given antibiotics, pain dissolves, and you're good. You can heal well. Unfortunately, if you have repetitive of those infections, you can actually get a perforation, which is a persistent opening of the eardrum. Unfortunately, that cannot be treated using medication. When we say that, it means you have to literally go and repair the eardrum at one particular time, because it has opened a place that should not be open. And so there's some interventions that can be surgical to make sure that you don't keep on getting infections.
All right, thank you, Daktari, for that. We are up for our first commercial break. When we will be back, we will learn so much more on how now to clean the ear, some of the habits that can lead to even hearing loss. Do not go too far, but first take a look at the myths and facts of the day. hearing loss doesn't affect the rest of one's health, an untreated hearing loss increases one's risk of experiencing cognitive decline, dementia, falls, social isolation, and depression. Hearing loss affects only older adults. Teenagers and young adults are at risk of hearing loss due to the unsafe use of personal audio devices and exposure to damaging levels of sound at noisy entertainment venues. All right, thank you for keeping it TV47 and of course Body Garage, where on this episode we are focusing on ear and hearing care, and with me is Dr. Grace Mwangi. Daktari, before the break we had dealt with ear infections, the anatomy of the ear, but also with the ear comes wax. What is its importance?
Okay. I like the fact that you called it wax. You didn't tell me the dirt of the ear.
The dirt.
Because that's a misnomer. And we loosely throw in the term uchafu wa masikio. So the ear also is fashioned to protect itself. And when we say that, you can imagine that we have some glands that are producing this gooey brownish substance that we call wax. So wax is not dirt. It is not dust that entered there. People will always ask, I work in Garissa or wherever. I think it's the uchafu imeingia huko. We all produce wax, and wax has function. Wax is supposed to protect your ear, and it's a lifelong production of it. And what it does is that it's supposed to ensure, even if an insect even tries to get in, since it's sticky, it can prevent that. That's the first thing. Two, it's almost like an emollient, or what we can say like a lubricant along your canal. Do you go oiling your ears?
No.
No. But they're oiled. Why? Because there's also that feeling of emollient inside there. It's also acidic. It has an environment it creates that protects your ears more so from infections, right? And so, since this is lifelong, you can imagine if you get to 200 or days as Methuselah.
Yes.
It also means that the ear has a fashioned way of trying to clear this wax. Whether it's through chewing, there's also a pattern at which it clears itself. And that's why even if you don't do anything to your ear, if you are to put your finger inside your ear canal, you'll get some sticky substance. Your ear is doing the perfect job. We have a rule in ENT. If your elbow can get into your ear, put anything else in your ear.
Okay.
Your elbow, leave alone mine.
Yeah.
That can still get there. If your elbow, you can be able to twist it and put it in your ear, put in. We give you the mandate to put anything. And when we say that, if your ear has a self-cleaning mechanism, why are we putting biros, Q-tips?
But it's because there's the itchiness.
The cafe, and you close your eyes.
And you're like, feels so good.
Horrible. Why? Because first you're getting rid of the excess of what should be there. Right? Two, you can actually push it further in. So people will go and manufacture, it's smaller, it's what and all that, but you can push it further in. Like any other bodily substance, it dries up. And after a period of time, if you're producing more and more and more, and there's a dry wax portion, it accumulates. At one point, what happens? Remember our cave? It gets blocked.
It gets blocked.
And all of a sudden, people come and tell us, I'm in a box.
Yes.
When I speak, I hear myself, people, I can't hear them. Then we tell you, we need to clean your ears, which I almost avoid using the word clean, because clean is all appreciated with that.
Yes. And when you say that, Daktari, before we even get to the cleaning bit, this dirt, because people say it's dirt, why does it lead to that itchiness that sometimes you feel like...
Because too much of it sometimes is not so good. It can give you irritation. And we do respect ears. My ear is not like your ear. It's like a fingerprint. That the caliber of your canal might not be the same. The amount of wax you produce might not be the same as mine. The quality of wax. Some people produce very brownish things and very sticky. And some of them produce very oily and very light, and they can even come and attest and say, I don't have wax. But believe you me, you produce wax. Now the problem is that the minute you get rid of this, you're interfering with that environment. And sometimes you get immaculately clean ears. And I can attest that I tell my patients, I don't like your ear, it's too shiny. Because that's the same patient who's going to tell me, my ears are itchy.
Yes.
Please clean them. I'm like, let me put a camera for you. Let's look at this ear. Shiny canal, shiny eardrum. What are we doing? And sometimes you just have to let it be, let the wax come in, and then create that normal environment, right? So you should never ever go probing for it. Basically, wipe the outside, leave the rest. But do we respect that some ears can have wax impaction, which is basically whether due to genetics you produce too much wax, whether due God made you to have a nice small canal, but you can hear with it, it still has tendency of getting it blocked. Then we do come in and assist by clearing what is excess. And so we always tell patients, please don't go back doing what? Probing. Why? Because there is really no schedule, even for cleaning. Do you understand that?
Yeah.
Like, you can tell someone, come after 1 month, I clean up your ears. No. It's the minute you have blockage, or it's enough to actually interfere even with your hearing, or to excess, right? And so what does that mean? You can actually go through your life not undergoing this procedure.
Oh, okay. All right. So, Daktari, you mentioned that there's some who produce wax in excess. Why is that?
Genetics.
It's genetics.
So genetics can affect that. There's nothing much you can change. There might be drops out here that are given, but the thing about drops that we give are to soften. It has no impact on whatsoever to reduce on the amount you produce. So the wax drops, and many people will come with them, it's just to soften in preparation for cleaning, right? Or clearing whatever is over there. But it doesn't really say that it stops wax production, which I always say, you need wax.
You need wax. Okay. And when you say that, you know, when you put biro pens inside our ears, you're sort of pushing the dirt inside. Is that leading also to the build-up?
Of course. As I said, you push it further in. 2, it dries up. It's like a drainage that you pushed a stone. Just because you can't see it, the stone is still there. So what happens? Any other wax that is forming gets a hindrance. So at one point, you are even prematurely blocking your ear by pushing these things inside. And that's why we tell you, do not put. That doesn't mean because your friend came here and they removed yucky, gooey stuff, everyone comes for syringing. And there's so many times patients will come and we tell them, no, you don't need syringing, or you do need syringing.
And now, what does this cleaning process look like?
It's very cool. You enjoy. You probably swim with all your clothes on.
Really?
It's not painful. Wax is not painful. And basically, you have a controlled pressure. And remember, it's a cave. When there's some substances we can put just to soften it more sometimes if it's too hard. And if we flush, everything comes out. So it's like a conduit. And people see what comes out and they're like...
It comes out from the other ear? Or from...
This ear is different from this ear. 2 different ears. Clean this ear,
and then you clean this other ear.
Clean this ear. Do they need to be both cleaned? Sometimes no. Sometimes it's just one. Sometimes it's both. Sometimes it's none. Yes.
Okay, it's things we watch on TikTok there.
Hallelujah. Now you know that you cannot put a wire on this side and it okay the other side. Yeah.
Okay, and there's a friend of mine who avoids the cleaning process because of, he says, the spatulas that sometimes you use to scoop out the dirt. Why is there, it seems like there's an option where you do not have to use the fluids? So
there's the fluids, which is basically you're applying pressure fluid, which can be just even water that had been sterile and you wash, right? 2, you can actually manually evacuate this thing. right? When I say manually, when they say the spatulas or these scoops or what, and when you go to YouTube, there are those things. We can use even microscopes, magnify your ear through these lenses, and I can literally use very minute things and come out with them. Those are different ways. I can use suction, basically put it inside there. All those are different interventions of trying to
But
clear
the
it out.
cleaning should not be painful.
Never. It should never be. When pain is an issue, there's a problem.
Okay, Daktari, could you mention to us other habits that, damage the ear?
Your headsets, right? The headsets are not a good thing for us. I think let me start with the basics. Ear care just means leave your ears. Wipe the outside, leave the rest, right? And when we say that, the men will go to the barber shops. They have all these interventions that are being done, massage and all that, and things are being done in your ears.
Leave it.
Leave the ear. We go to the supermarket. Please leave the earbuds. Walk away, walk away. Wipe the outside. We say the rule is if your elbow can get in your ear, probe it. You have been given all mandate. In other words, leave that ear. If there's pain, if there's reduced hearing, if there is noises, if there's dizziness, see your doctor. Because I told you, those are now things of an unhealthy ear, right? Over and beyond that, noise. Noise is, if the ear is for hearing and you have this excessive noise, you're damaging your inner ear. And remember, we said your inner ear is irreplaceable. Control your sounds. So if you are doing a virtual meeting and you're alone somewhere, why should you use headsets?
Okay, now let's move to a hearing loss. What is it?
Hearing loss is a reduction in the level of hearing. And every year, annually, WHO has created what is known as the World Hearing Day, which is that of March. And it always has a theme. In 2025, we are going to be empowering ourselves because preventative medicine is better than curative medicine. If I tell you what I've told you, at least you know that these ears are not communicating and you'll not buy that cotton bud and you might miss out on a concert. It will have saved me your ear, even if it's a few more years, right? But when it comes to now how we are able to sort out hearing loss, because that's what people are most concerned about. Do you know your child starts hearing as early as in the tummy? And that's why people will put music. They will keep on talking to the child. So some of the things as ENT we advocate for, if you are newborn, even before being born, can hear, can we please ascertain that? And that's why we talk about newborn hearing screening. A child who has just been born, whether preterm or term, cannot tell you whether they're hearing or not. But technology has taught us to be able to do screenings, very quick second screening to tell you, child can hear, child cannot hear. What are the implications of that? Social life, financial well-being, the qualities of this child is totally different. So we are always advocating for newborn screening. Any child who has been born, me, you, we were denied newborn screening, not because we were denied, but also probably our parents were not aware, but every child should be able to be done that, right? So that's newborn screening. Even if it's 1 million children and you pick 20, the life of that group has changed. So newborn screening is one of the things to be able to pick up hearing losses early. Why? Because you can get to be born with a hearing loss, what we say congenital. Whether mommy had an issue in pregnancy, whether during birth, baby got tired, remember the brain is the controller of everything, whether the child was born preterm, all those are very vital things, and you can be able to pick up these issues even before the child starts complaining or you pick up delays. Now, what is the delay? Speech development. Because speech and hearing go in tandem. So most of the times we will see parents bringing in the children because kijana amefika 2 years na vijana wanakuaga slow to the female power.
We are faster.
We are the superpowers. Because they always say the men are a bit the boys. Or COVID came, or social media came, ni mtoto wa social media. No. But at one point, there's going to be that point where you get a bit jittery. Why is this child at 2 years saying mama, baba only, or nothing, or not responding to sounds, and then there's a yappy child next to them
who knows everything?
So that's where we want to pick up early. But things can also go wrong, that you can be born with hearing, God forbid, get an infection, whether ear infection. Remember we said the perforations, that has affected your hearing. Meningitis, it's in the brain, but it's affecting the nerve, gives you a hearing loss. Then you can actually be able to assess hearing later, even as an adult, then to find out what is your level and what can we do about it. Yes.
Okay, Daktari, thank you for that. We are up for our second commercial break. When we will be back, we will talk about now the treatment options that are available for some of the ear conditions that do exist. Do not go too far. Keep it TV 47. Thank you for keeping it TV 47. Of course, this is Body Garage, where on this episode we are focusing on ear and hearing care. And with me is Dr. Mwangi. And Daktari, so before even we continue to some of the treatment options that are available, what is this machine that has been beside us the whole time? What does it do? And when someone comes in for a checkup, what do you do?
Okay. So ENTs, we like to say we work in small dark places. So light is of the essence. So every time when you see us, we might have this big gadget that we call the headlights, which is basically our light source when we are examining probably your nose or your throat. The ear, remember it's a cave, it's dark inside there. So there's what is known as otoscopy. Right? Otoscopy is basically we're using a magnified instrument that is able to visualize into your canal. Technology has changed. You also want to see how cool your ear is. So with this, we also are able to connect to video imaging, and we're able to show you your ear on screens. That's examination. We can look with cameras in your throat, in your nose, and in your ears. Right? And then now we can talk about, that's looking. Now we can start talking about function. Because, you know, a non-hearing ear does not mean a broken ear. It can look cool, okay, but I tell you, you still tell me, I can still hear. Then that's the time we talk about hearing assessment to look at function. Yes.
And how often would you recommend for someone to at least get a checkup?
Okay. Remember we said hearing loss is an invisible disability. Please be mindful to do it at least annually. Okay. When you are on the older spectrum, you want to do it more often. Remember, age is a factor. But at least once in a year or once every 2 years, please get your hearing assessed. Fortunately, there are so many stakeholders that are coming on board, because we can say at-risk workers. If you work in a place that has high levels of noise, if you work in a factory that has a lot of machinery, if you work in customer care, which means there's always constant telephone calls, if you work in an airport and there's all these noises, the factories, all these companies actually do annual checkups for you, whether you complain or not. And those are important things that people who are employed in those areas that should know that happens.
Okay. And now when someone is getting, I'm sure with eyes, there's the eye test. So with hearing, there's the hearing test. What do you check for? What do you test for during that time? What are the tests that I will undergo?
Okay. So we said 2 main functions, hearing and balance. So you can actually test for both. Whether, and when you talk about hearing, remember we said even a day-old child can be assessed for hearing.
Yes.
And even know to what level. And this is because we have what is known as pediatric assessment, which does not rely on the child getting us feedback as to whether they tell us whether they can hear or not. Because even a 10-month-old doesn't even know what you're doing, right? But because we say that this is translated into a neural signal, it creates a pattern. If this pattern has to go A, B, C, D, at normal levels, but I have to put this level at a higher volume, there was the hearing loss. So there's what is known as ABR, which is just a test that is not limited to the patient telling us whether they're hearing or not. This also works quite well for malingerers, for those people who want to say, hey, you know, every time when I'm in the studio, you guys have been making noise and I can't hear, and it's because of those studio. Whether you like it or not, that test will tell us if your hearing is 100% or not. Now, over and beyond, of course, there is other tests that will probably take 30-40 minutes, and you're able to get to know your hearing at different levels. And when you say different levels, hearing loss is not just a broad term. There's also grading. You can have a mild hearing loss, moderate, severe, profound, and the higher it is, of course, it means the higher the hearing loss and more effects to your quality of life. Yeah.
You said there's the mild to severe. What is first the normal, hearing?
Yes, so the volume is 0 to 25 decibels. That's why you want to be able to hear. When we say that, so this is measured, whether you are looking or not, you can actually hear a tone that is introduced. So you're blinded.
Oh.
Okay? Whether they put that sound at 100 decibels or whether they put it at 0 decibels, your work is to figure out in a soundproof room, can I hear the sound or can't I hear the sound? Okay?
So
now,
even when it's at 0, I should be able to hear
now,
it?
if you told me you are deaf, I would first tell you you're not deaf. We're having a conversation.
Yes.
And conversational speech can go up to around 30 to 40 decibels. Now, we no longer say deaf because deaf you're saying 0. You are hearing nothing. So it might be very high sounds over there. So basically you can be able to get the level of hearing for someone through a very simple way of you being introduced to sounds at different frequencies. When I say different frequencies, if you take a dog whistle, we might not hear it, but the dog hears because they hear at a different frequency.
Yes.
The human ear has also a range of frequencies that we know that you should be hearing. There's also suprathreshold, a bat. A bat, if it was possible for me to do a hearing assessment, it will be on another level. So there is very simple, clear hearing assessments that are done daily, if not probably today we've done almost 10, 20.
So it's a procedure that can be done within a day?
Less than even 20 minutes, you'll be able to know your level of hearing.
Okay. And when we're talking about, first you brought in people with hearing impairment, so they really do not hear anything.
So remember there's the degree?
Yes.
So the higher the degree of loss, the worse the effect.
Okay.
Right? So it means that for someone who has a hearing loss, there's some that we can actually intervene and operate or do something to correct it. And when we say that, if you have a hole in your eardrum, it means we can repair the eardrum and restore the normal pathway, right? If you have wax that is blocking your canal, I can easily go clean it out over there and you hear.
Yes.
If a child comes here and has stuffed clay in the ear, we can sort out that. If, let's say, for example, someone now got a punch, and let's even say you got meningitis and your hearing loss is there. Now, that's the inner ear. That's a totally different thing. So there's some people we end up with hearing aids because a hearing aid is able to amplify your level hearing for you to hear. There's some people we operate, and then there's some people now we do what is known as cochlear implantation, which is to actually restore hearing because your inner ear has been affected. Yes.
Okay. Now, I would love to have now, what are some of the treatment options that do exist for ear conditions?
Okay. As simple as cleaning, as simple as if you have, let's say, for example, the holes in the eardrum, repair the eardrum. If you have an infective process, the surgeries that can be done to clear not only the infective process but repair what is destroyed. But over and beyond that, I would want to say there are some people now, let's say age, you're hearing at 70%, and when you go to church you can't hear and you have to sit at the front. If you get a hearing aid, you're okay. Now, for the people where their inner ear is affected, these kids who have been born preterm, can't hear nada, then you can do a cochlear implant, which is basically a surgically implanted implant in your inner ear to be able to send that signal.
So it's inside.
Yes, it depends with what is causing your hearing loss. Yes.
Okay. And for the hearing aid, how fast does it look like?
Oh yeah, that's a good question. People find it cool to wear glasses, right?
Yes, it's very cool.
I mean, that's why we wear shades, all right?
Yeah.
That's why you will not find on the streets, even on the traffic, they're selling shades, right?
Yes.
They seem cool. But if you talk about it, it's just because also there are people who wear glasses for corrective reasons. A hearing aid is as good as glasses. You have a deficit, and if your hearing is at 50% and they can amplify it to 100%, you're able to hear. Now, hearing aids no longer are those big, bloggy, brownish, big things.
Yes.
They have undergone a lot of technology from analog to digital. There's hearing aids that haven't been made as minute and as small that I can be seated next to you and you don't realize I have a hearing aid because they're in the canal. Do you know that there are hearing aids that can even connect to your phone?
Ooh,
people look like
cool.
I'm seated over here and then you just see someone ding, then they start speaking because their hearing aid is connected to their phone. And so hearing aids have undergone a lot of technological changes to make them as minute, as small as they are, as amplified and as techy as they can be. And that's why we always tell people a hearing aid does not serve you any purpose being in a drawer. It needs to be in your ear. No longer is that adage of it has to be bulky and ugly looking. That's why it has undergone a lot of can I say technology changes.
Okay. And what are the potential complications of living probably an ear infection untreated, or even, you know, hearing loss?
Probably most people will want their infections treated. So whether they come to us, whether they're in the village or what, they will definitely see a doctor. Now, probably the impact I would want to talk about hearing losses is the financial impact.
Yes.
The social integration that is affected. You can imagine that child who's told they don't listen.
Yes.
And so what happens? The academic performance goes down because remember they can't hear. So there is a lot of financial, socioeconomic kind of effect to it. And in the long run, as I told you, if you are able to pick up these things early and you can actually be able to rehabilitate or restore hearing for this child, we should be able to have the same kind of life, right? And we've had that through the cochlear implantation group.
Okay, Daktari, as we wind up, probably what are some of the lifestyle changes that people should adapt to for good hearing, and your final do's and don'ts when it comes to taking care of the ear?
The ear is as vital as your heart. It's as vital as your eyes. And leave your ears. The ears can be kind to you. You just don't have to go and probe them. However, if there's pain, if there's hearing loss, please see your doctor. You can actually be able to salvage that. Over and above that, kids are always being born. If there's anything that I can say today, newborn hearing screening. Preventative medicine is way better than curative medicine. And as the World Hearing Day comes in and we are talking about empowering ourselves, that child who's been born and has undergone hearing screening and you have the peace of mind to know that my child is hearing, saves a whole generation, if not generations to come. The child who has no hearing also saves another generation because you're able to work on it early, right? But beyond that, happy ear day. I remove the Y. Happy ear day. Leave my ear.
Leave the ear alone.
Leave the ear.
As the last question, Daktari, there's always the ear drops.
Yes.
Someone just feels a little bit, you know, a disturbance. There's the ear drop to treat it. What's your advice for that?
Wacheni kuku ya nini mafuta ya kuku? acheni mafuta ya, is it kondoo?
Yeah.
The tail.
Yes.
If there's pain, take a painkiller. Come see the doctor. Well, if an insect walks in, probably that time you can put a cooking oil, because an insect will not give you peace. And when I say that, we've seen cockroaches, you just have to stay for it. You can put that. Beyond that, take a painkiller, come see your doctor.
Come see your doctor.
Wachana na hizo mafuta zingine.
Above and beyond, it's Happy Ear Day.
Happy Ear Day.
Thank you so much, Dr. for having us. It has been a joy and pleasure hearing and learning from you on some of the ways that we can take care of the ear as well as our hearing. And that is it for us on this particular episode. I hope that you back at home have grasped one or two ways that you can care for your ears as well as your hearing. This is all from me here tonight on Body Garage. Thank you for always keeping it TV47. It is always a pleasure. Have yourselves a lovely night.